Hey there, it's Liz. Welcome back to my channel, and if you're new, also welcome. Today's video is all about nursing students and the 7 questions you absolutely should ask when you are going to go get a job. So if that's you, you're a nursing student, you're getting ready to go look for a new job, here are my 7 questions I wish I had asked when I was interviewing for nursing jobs. And before we get into the first question, I also made a video, it's on my NP school channel, but it has a lot of general interviewing tips. I'll link it up here, wherever this is. You can watch it. It has just good general, like how to do an interview. Just ignore the parts that are specifically about NP school. So check that out if you're interested. Question 1, how long is orientation? And the second part of question 1 is, how much of my orientation will occur on the shift that I'm going to work? So when you're looking into your orientation, you're probably going to want to make sure you have at least, 6 to 8 weeks if you're a new grad minimum. And you want to make sure some of that is going to be on the shift that you're going to be working. I know on mine, when I oriented to my first job, I had a 6 weeks orientation and only 2 of the weeks I think were on the shift that I was on. And the floor I work on now, you can go through your whole orientation pretty much and only have like a day or 2 on the shift you were going to work. But in day shift and night shift, even eves, are very, very different animals in terms of what you do, how the flow goes, everything. So just, you want to have a little practice on the one you're going to work on and make sure your orientation is long enough. Second question. This one might be one of the most important ones. What are the nurse-patient ratios, and do they ever go above that? So I would say for a general med surg floor, I know some places go up to 6. My floor went to 5. And 5 is a lot, especially depending on the acuity of the patient. So if you're in a situation where your patients are really sick, or you have a lot of patients that need total care, where you're turning every 2 hours, you're doing everything for them, they're incontinent, that's a lot of work, especially if you have 6 of them. Ask if, hey, when I'm brand new, will I have less patients? Like maybe if you're a new grad, you only get 4. Find out what the nurse-patient ratios are. Question number 3, how long do your nurses usually work here? Or you could phrase it like, what percentage of your nurses have worked here for at least 10 years? That's going to tell you how long people stay, and that speaks volumes. My first nursing job, I didn't ask any of these questions, and this is one I truly wish I had, because I'm not kidding you, there were probably 15 or 20 nurses out of the 80 that worked there that stayed past a year and a half, which was the requirement we had to stay, and then everyone bailed. That says a lot about your unit, says a lot about your management, whereas the unit I'm on now, a ton of people stay. I would say the people that have been there at least 10 years means the management's probably good, the population's good, they, care more about you, and people enjoy their work. Number 4, you're gonna want to know what type of patients you see on the floor. So I would just ask, give me an example of the 5 of your most common patients. What type of, are you having people that are coming in with cystic fibrosis? Are your patients in heart failure? COPD? Is this primarily like a med surg floor? Are you doing a lot of surgical stuff where you have patients who come in, they're there for a couple days, and then they get out, hip replacements, knee replacements, you get the point. What are you seeing the 5 most common things? That would be good to know. That way you know if you're gonna like it, because what if you're interviewing for this floor and they were like, oh yeah, we're med surg, and you're like, oh, I think I could do that. And then but you hate like respiratory stuff. That floor might be called med surg, but they almost only do respiratory stuff. I would find that out before you work there for a while. Number 5, what are the resources that are available for nursing? So this is gonna vary obviously depending on the size of your hospital, but it's gonna be good to know, do you have a phlebotomist that's gonna come and draw labs for you? Or do you poke them and draw their labs? Do you have a team that comes and puts in IVs? Or are you expected to put in the IVs? Do you have volunteers, if you work in like peds, to come hang out with the babies? Are there sitters that are going to sit with your patients that are confused? What are the assistant personnel? How many are there? Is there one tech for the entire unit? Is it like every 3 nurses gets 1 tech? How does that work out? What are the techs like allowed to do? That would kind of be helpful to know. Are there things like lift teams to come help you with your patients? What do they have lifts in the ceilings to help you lift your heavier patients? Can you tell I worked on a floor with a lot of larger patients? What are the things that are built in to help you succeed? Because you can't do this all by yourself. Number 6, you're going to want to ask about holidays and vacations. So I wouldn't go in phrasing this like, hi, I'm new and I want Christmas, Thanksgiving, and the 4th of July. No, just kind of ask so that you're prepared and you can kind of get an idea of when you might have a life again. I know that sounds bad. And like, what's the schedule? I know some hospitals are you work every other holiday. So you work Christmas and then you would have Thanksgiving off, or you kind of like bounce and then the next year it's the opposite. The hospital I work at, it's by seniority. So you're not going to have Thanksgiving, Christmas, 4th of July off until you've worked there probably like 5 or 6 years, depending on the seniority of your unit. And with all of these questions, you're going to have to remember it's your first nursing job. It's probably not going to be your dream job. It's going to get maybe your foot in the door of the hospital you want to work at. I would just find what your priorities are. If your priorities are, you want to travel in the summer, find somewhere with maybe a more flexible vacation policy. If you want to work on, like a unit to gain a lot of skills, you might be willing to put up with more things to achieve your dream of working like in an ICU. Or in my case, I kind of chose the floor I did to get my foot in the door because I really wanted to work with kids, but it was hard to get hired straight into the peds hospital, so I went to the adult one. And number 7, this I cannot stress enough. Ask if you can shadow on the unit. I didn't shadow on my first job, so I was totally shocked when I walked on the unit and it was not how it was described to me in that interview. So ask if you can shadow, and ask if you can shadow on the shift that you will be working. So if you work nights, that doesn't mean you have to come in at like 2 o'clock in the morning. Come in at like 7 p.m. That's usually when the night shift starts. Or ask if you can shadow from like 7 to 11, something like that. So you're going to see the shift you're going to work on and see how the flow goes. This also gives you the opportunity to talk to the nurses that already work there and ask them, do you like working here? Would you work here again? I think that's a huge one. Like, if you had the chance all over, is it worth it as a new grad? Scope out what that shift looks like. If everyone looks like they're like having like 1 year of experience or less, ask them, hey, why don't people stick around here? Where are they going? Ask them if they feel safe. Do you feel safe at this job? Do you feel like your ratios are okay? Do you have enough time to chart? Do you usually leave on time? Or are you sitting there at the desk charting for an hour after you go home? And again, just look at the patient population. You're going to be able to see more like, is this something I would like to do? Usually when you hire in, you're going to be there for at least 1.5 years, and you have to at least not hate it, hopefully. Can you imagine yourself on this floor, or does it seem kind of like a vibe that you're not truly liking? It may seem kind of awkward to ask the nurses these questions, but I promise you, if anyone asked me that, I would be honest, and I think that would be really helpful. So yeah, those are my 7 questions I would absolutely ask in an interview to get your first nursing job. Good luck in your interview process. Don't be discouraged if you apply 1 billion times and don't hear anything back. That was the story of my life. You are going to get a job. You are going to do great. Good luck.